Leo. And
okay, thank you,
move
Carrie.
the ball so you can
to me. Okay,
move the slide.
got it. Got the ball. Thank you. Pleased to be with you today. The ARC of Massachusetts is an advocacy organization, and we have a history of unbelievable accomplishments over the decades for people with intellectual and developmental disabilities such as Down syndrome, autism, cerebral palsy, and so many other conditions that fall into that general category. And the history really started in the 50s, and along with the ARC of the United States and other affiliates across the country, we have a strong record of national achievements from IDEA, the education law, to the Medicaid Reform Acts, which allowed federal funding to support the growth and nurturance of community services. And in Massachusetts, we've been involved in every annual budget cycle since the 50s, helped start the first programs. Historically, family groups established the ARC of Massachusetts across the state, and affiliates formed the backbone, and now we're pleased to have wide support from not only affiliates of the ARC, but other organizations, and most importantly, families and others who support our work. The last 25 years, we've had, in addition to seeing the end of the consent decrees, which the ARC was a plaintiff in, which established the basis of the community system, we also were involved in Boulay waiting list, Rowland lawsuit, and Mahoney versus Weld, which is the least known probably of the three, which allowed people to leave institutions. Boulay was a waiting list case, and Rowland related to nursing homes and people stuck in nursing homes. But in addition to that, there's so much around legislation, the Autism Omnibus Act, 2014, acts, the variety of the Real Lives Bill, and a variety of other bills that, had a big impact, including Chapter 766 and Chapter 688, which is the transition law. So we're happy to be with you. And today, the focus is on MassHealth. And MassHealth is a very important system, very important for our constituents. I'm just on a different computer today, so I'm just learning how to move the slide, which is interesting because it's not moving for me. Okay, so bear with me as I try to learn how to move the slide. Okay, I learned. All right. So basically, the picture there is part of my history presentation. I should have moved it earlier. So in addition to health care, the majority of long-term supports and services, which is called LTSS. So if you hear me say LTSS again, just think long-term supports and services, which I'll define in a couple of minutes. They are funded through Medicaid. And in Massachusetts, Medicaid means two things. It's the MassHealth, which is really the embodiment of Medicaid, and that's sort of the insurance kind of role it plays, public health insurance. But Medicaid also underwrites these long-term support services, whether they're at Medicaid and MassHealth or whether they're at the Department of Developmental Services, Massachusetts Rehab Commission, Department of Mental Health, and elsewhere. In fact, local educational, programs, schools, much of the specialist services are underwritten by Medicaid. Massachusetts receives 50 cents for each dollar it spends in MassHealth or other Medicaid-related programs from the federal government. So it's important. It's important to know about MassHealth, and it's clearly not only an important funding program, but it's also important in terms of your services. What does MassHealth cover? Well, as noted, it's a public insurance which underwrites other disability services, and then the things through MassHealth itself: health care, drugs or RX, dental care, hospitalization, emergency care, rehabilitative care, long-term supports and service, and other services. And you can learn more about the other services with this link I have that you'll be able to download if you're watching this. Here now we define long-term supports and services in MassHealth itself, and that's day habilitation services, adult foster family care, personal care attendant services, or the PCA program, continuous nursing and home health services, durable medical equipment, and adult day health, and more. So I will try to repeat the names if we're touching on one of these. For example, day habilitation services doesn't really have an easy nickname, but adult foster family care we call AFC. Personal care attendant services is PCA. But if you hear me talking about LTSS, that's all these services, long-term supports and services. And depending upon you or your family member, what you need from this cluster in addition to the health care and other items I mentioned earlier, will be affected by what you need, obviously. 474,000 people are members of MassHealth who have disabilities and or older adults, okay? Of those, you see on this chart, 12% are in comprehensive coordinated care models. I'll explain that to you in a minute. 63% of them have both Medicare and Medicaid. So when someone says that's the word dual eligible, that means the people are both on Medicare and Medicaid. I am using a slide from MassHealth, so I'm limited by that slide. But in terms of age, 8% are children in this 474,000 group. 54% are adults with disabilities, so the majority. And then 38% are older adults. And, you know, and older adults would probably be targeted at 65, not probably, there it is, 65 and older. So the reason it's important to separate who's in Medicare and Medicaid versus who's just on Medicaid, any novel program they start or any initiative they start, if people are on both Medicare and Medicaid, they've got to worry about negotiating with Medicare too and the Medicare benefits implications, whereas people are just on MassHealth or Medicaid, you know, it's in a way, you could say it's easier. It's never easy, but it's at least one insurance program you're dealing with. Integrated care programs, which is a lot of what this slideshow is going to be about today, the upcoming change to more managed care. Integrated care means they try to provide you everything that MassHealth offers through one vehicle, one insurance company, or one healthcare entity. So, for example, OneCare is a relatively new program, been around for 5 years, that focuses on people with Medicare and Medicaid, and it's for adults, okay? And basically, it offers in one package whatever people will need, and have to do assessments and all that, and somehow, you know, figure out hopefully an effective plan for care. PACE program, which I don't remember the initials, what they stand for right now, but it relates to elders, seniors, and Senior Care Options, which is SCO, also relates to seniors. So both of those would be if you're 65 and older, and those programs would kick in. Of course, the elder population, those that haven't had disabilities before and have them as seniors, you know, it's a very different experience because their choices are often nursing homes, if they're not able to get in-home care, or an integrated program such as a SCO or a PACE. MassHealth enrollment has been rocketing. It's been unbelievable, the growth. And so, as I mentioned, 474,000 have disabilities that are members of MassHealth out of almost 1.9 million people. Not I think. It is 1.9 million people, just to give you a sense. That number fluctuates a little bit, but right now the goal is to try to get a bunch of these people that don't have disabilities on a different insurance program, because basically MassHealth, you know, is an expensive way to do it. Medicaid and managed care. From Medicaid's case is, look, we're paying on a fee-for-service basis for each visit, procedure, or test. This means people can have uncoordinated care and high costs. Translated, maybe because they're paying fee-for-service, maybe someone doesn't pick up something during a visit that could be proactively addressed through a procedure or a referral to the right specialist, and they end up in an emergency room, or they end up in inpatient care. Maybe someone ends up in a psychiatric hospital because they didn't get the right medication review because it's uncoordinated care. So the goal, what they're trying to do is a new managed care effort through major health providers, or even non-major ones, but through healthcare providers, called Accountable Care Organizations, or ACOs. So LTSS was the first abbreviation I fixated on, long-term support services. Now you're going to want to remember Accountable Care Organizations. And these are going to be the entities, the healthcare entities, that are now become the new doorway for MassHealth programs, one of the major options for people on MassHealth. And as a doorway, they're hoping they will provide integrated care, because each of these ACOs, when they get a member of MassHealth into their roles, they will be responsible for the total cost of care for that person, okay? And therefore, the choices in the future will be now these new ACOs, accountable care organizations, existing managed care organizations or managed care options, MCOs, and primary care clinician programs. The latter one, the primary care clinician program, is the fee-for-service program. And often people have stayed with that, especially if they have disabilities, because they're not sure if their specialist is in a managed care program that exists. And that'll be a key factor here as you consider if you want to be or your family member wants to be in an ACO and which one to pick. By the way, we have an enrollment guide, too, that's posted and can be sent to you. I'm sure there'll be an easy way to access that. You can see it under Program Services at our page. And, of course, you can also access it through the MassHealth government page, mass.gov/MassHealth. But we'll have it up as well. And you want to see pages 2 to 5 for a little more in-depth discussion of these different options. MassHealth needs to meet the goal of reducing the trend of increased costs in Medicaid by year 5 by 2.5%. And so the good news is they're not expecting to cut back the cost. They're expecting it to still grow, but they're trying to slow down the trend line, and the federal government is basically giving them an agreement that they'll get penalized if they don't do that. They'll get rewarded if they do that. And by rewarded, meaning the money they've committed to give to the state. If they don't meet that 2.5% change in costs, MassHealth will be penalized, or the state of Massachusetts will be, by some dollar value. The other things they'll be looking at, the federal government, is the quality of services, avoidable use of expensive care. By quality, for example, if someone's diabetes, how well are the people with diabetes being tracked? Taking statistics on that, things that are easier to track, versus person-centered plans are much harder to track. ACOs, accountable care organizations, are responsible for the costs, as I said earlier, total cost of care and integrated care, and they want to avoid unnecessary hospitalization, emergency room care. And the ACO will serve only MassHealth-only members. You can't have private insurance in MassHealth. You can't have Medicare in MassHealth, and that's probably a third of our constituents. It might be more than that because DDS, Department of Developmental Services, doesn't have everyone on their rolls. I'm sure there's people that are semi-employed or were ruled ineligible because of mild intellectual disability or mild developmental disability that probably are people we care about and are our constituents. And and then those that are on specific DDS, and I'm not going to get into depth on this, waiver program. So if you are in a residential program or a day employment program through the Department of Developmental Services, you're still eligible, but those DDS services will not be counted in the total cost of care, and no impact there. In addition, the accountable care organizations will have no cost of care right now in LTSS, or long-term supports and services. They're focusing on getting their act together in healthcare itself, which is prescription, durable medical equipment, not durable medical equipment, I take that back, prescriptions, healthcare, dental care, use of hospitals, those kinds of things. There's two types of ACOs, accountable care organizations, and they're both dependent on your choice of primary care physician. So if you have a primary care physician that is already enrolled in one of these programs, you will have gotten a letter by now. In November, letters went out saying, oh, your doctor's in this program. You are now a part of this ACO plan. And you would have to say, no, I'm going to switch doctors. Because your doctor, if they're in an ACO plan, they can't also be your doctor in the primary care clinician program anymore. So if they were in the PCC or primary care clinician program, which is fee-for-service and something you may have wanted to stick with, you will have gotten a letter saying, I'm sorry, your doctor has now moved to whatever, ACO, blah, 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 blank, because there's quite a few of them, 17 of them. And there's two types of ACOs, as I said. One is called a partnership plan, accountable care organization partnership plan. In this case, a group of basically primary care physicians work with one managed care organization to create a full network. So that could be the Steward Health Care Plan or the Partners Health Care Plan, okay? The second kind, and there's 3 of these, so there's 14 of those. There's 3 of, I'm pretty sure there's only 3 of these, but they're fewer in number for sure. are called primary care ACO. So a physician group contracted with MassHealth and said, you know what, we're willing to do this. We can get integrated care. We think that makes more sense for us, given how much less, MassHealth may pay than Blue Cross or Harvard Pilgrim. And basically a managed care organization backs them up on the total cost of care. So, and this isn't really your problem. It's more the, healthcare entity's problem, but because Massachusetts stands to risk, fall or gain, depending on its success, this program, so do these physician groups. So in the case of the primary care ACO, they want to be backed up by a managed care organization, which will get some of the income, but they'll also will take some of the loss, a major part of the loss, if there's a problem and they don't meet the goal. The full network gets defined by MassHealth and the managed care organization. And again, you'll see in the booklet, the enrollment guide, there's plenty of information on this. Managed care organizations still will exist, and that's an existing option, which is by region. So some of the ACO partnership plans, they're all over the state, a couple of them, right? You could be anywhere and be part of that plan, and that also means that networks across the state, whereas managed care organizations are defined by a region. MassHealth is working on some issues, and I'll tell you about a couple of issues that just came up last week. And then finally, primary care clinician, PCC program is fees for service. But you would have to coordinate the care. You'd have to work at it. If you've been doing it for years, you know what I mean. It's not easy, and MassHealth would like to move away from the option because they think it's more cost effective not to have just that option. Well, two of the things that just came up recently was, what if your primary care specialist is a neurologist, okay, because of your disability or your son or daughter's disability? But they're not identified as a neurologist technically. Like they were accepted as one in the PCC program, but they never were registered under MassHealth as a PCC. So you want to check, whoever your doctor is, if you have a specialist who's your primary care partner, I would go online, not online, look and check wherever that person is, check in the enrollment guide, the different partners, the different ACO partners or groups, to make sure your doctor, neurologist, especially in the case of specialist, is no longer in there. If your doctor is a primary care practitioner, trust me, you would have gotten a letter soon, and there'll be a second wave of letters soon after that. I think November 17th, the first set went out. Oh, your doctor's in this ACO, and you would have had to, if you ignore it, that's the ACO you're in, or your son or daughter. Basically, the goal is for these ACOs to partner in new ways, again, reduce the silos between different services, and in the future, how this affects long-term support services and how many LTSS, long-term support service contracts there'll be between ACOs and providers remains to be seen, especially where the long-term support side of it is yet to be seen. It's 2 or 3 years away in terms of connecting things like adult family and foster care, personal care assistance services, continuous nursing into this ACO structure. Community partners are local organizations that are either in the mental health field, developmental disability field. Mental health could be behavioral health. That's another word for it. It's a word that covers both mental health and substance abuse, among other things. So base or elder services, those are like the 3 buckets, examples of buckets in terms of long-term support services, independent living centers. ACOs, these accountable care organizations, will have agreements with community partners, or all of them already do. I should probably put it in present tense because everything's live. March 2018, actually, the program goes fully live. So you really, if you did get one of those letters, you want to act quick if you want to not stay in the ACO. You won't be able to get out of it for a year. Community partner organizations, CP is what we're calling them. Sorry for yet another initials. Will serve in a coordination role for people on Medicaid who have the need for long-term supports. They also will be affected financially if state goals aren't met. They have to have expertise, like we said, in behavioral health or long-term supports, and there are currently 9 community partners for long-term supports and service, and there are 18 for behavioral health. The 9 is probably because the reimbursement for long-term supports and service is pretty darn low, and the reimbursement for behavioral health is twice that. LTSS. And you have to be expertise in all areas of mass health services. So to be a community partner, you technically had to know about mental health, substance abuse, developmental, intellectual disability, elder care, and physical disability. And so that was the expectation anyway up front. A pilot was launched last year in 2016 in the fall, so that details could be ironed out before the full launch. And I've already said that people will be placed based on their primary care position. And if people want a choice of a particular ACO and they're ready to do that, if you're ready to do that, say, geez, my PCP is in, or I don't have the primary care practitioner I used to have, I'm open to picking one. You could basically, if you choose an ACO because what you think their care team might be like, whether it's, partners or steward or children's or whatever, you can do that, and you have to pick the first step is picking the primary care physician. The start date is March 1st, 2018. This is the diagram. It's really not a great diagram, and we'll try to see what they come up with next. I'm sure they're working on a new one. Actually, I saw a slide today that I'd like, a couple of slides that are actually for a second one we do. I will share it. I just saw them last Thursday. But basically, when you look at this chart, the ACO is in charge of approving the plan and purchasing the services. So they would pay for, if you think about it, all your healthcare stuff, all your LTSS stuff. If you're already an existing LTSS, they're not doing that right now. That's not going to get tied in until 2 or 3 years. But if they have a new referral, I'm assuming someone turned 22 and suddenly they want PCA, they may have some role in that process, but again, they won't be financially responsible. The community partner, if the ACO feels like they need the help, they'll refer the case, depending upon the need of the person, to one of the LTSS certified community partners. So HHS has certified, as I said, 9 and 18 of them, depending on what area we're talking about. And I've focused here very much on LTSS, but they then subcontract for subject matter expertise. You'll hear more about that in a few minutes. And if you look over to the right of that slide, right as you're looking at the computer, you'll see the different people they might contract with for an assessment. And by the way, within that LTSS group, they may do the assessment as well. That remains to be seen how many they refer out, how many they could do themselves. And then they work together with the ACO in a person-centered care plan that, again, is controlled by that ACO, since they're the ones that are going to worry about total cost of care in the long run. And then there should be 3 referrals given for service options. So one of the things that came up is MassHealth is still trying to figure out what's the right balance between community partners holding cases and non-community partners getting cases. And we had a little bit of that discussion last week. It's complicated. The other thing that came up is if someone has, I think we talked about this a second ago, don't assume that if your neurologist and you want them to continue being the PCP is in an ACO that you're going to automatically be able to get them. You should reach out and check in on them to continue as a PCP, primary care practitioner. Anyway, let's keep going. The ACOs, there's actually 17 of them, as I said, and what you want to do is look at that enrollment guide. Look at it by, someplace like Bay State Healthcare Alliance with Health New England. That's going to be cited mostly in Western Mass. Okay, some are, clearly statewide. Boston Accountable Care Organization with Boston Medical Center Health Net Plan. They're tied in with an MCO, Managed Care Organization. So Community Care Cooperative is an organization of 13 federally qualified health centers. The Health Collaborative of the Berkshires has tied in with Fallon Community Health Plan. So you can see that there's different partnerships. Atrius Health has partnered with Tufts Health Public Plans. So Atrius doesn't want to take the risk alone. It has Tufts Health Plan, which is a managed care organization, as a sort of entity, as a wraparound to protect it. But what you care about is less that. You care more about who are the doctors, the specialists, what are the different benefits, and that's in the enrollment guide. And for any of you with experience with Medicare and Medicare plans that show up annually, it'll be similar to that, probably not quite as complicated, but you'll be looking at what the different options are. And you can see Leahy here and Mercy Health, Merrimack Valley, Partners Healthcare ACO, Reliant Group with Fallon Community Health Plan. So Fallon shows up a couple of times. Boston Medical Health Center and the Health Net Plan shows up a couple of times. So it really, Steward's doing its own Medicaid care network. That would be a partnership health plan. And South Coast Health Network is doing it at Boston Medical Center. Again, you see Boston Medical Center Health Net Plan shown up a couple of times as an MCO. The community partners, there's 9 of them for LTSS. I don't show the behavioral health ones. Easy to find. And basically, what you do if you need a behavioral health community partner, you would use the guide. You would go through the ACO and then identify who that community partner is, which they should know, by the way, at the ACO. You can also go online, again, mass.gov/mass, and in this case, you could look up MassHealth Innovations. But MassHealth by itself, too, you'll be able to see the listings. But here's the 9 ones that are involved in long-term supports and services. And some of them, I think one of them is statewide out of all of them, or a large service area. Most of them are very regionalized. Let's take a look, because we broke these out specifically. So Alternatives Unlimited is a community partner. It includes partners in Central Mass, and you see the region. See the region is Central, and you get a sense Athol, Framingham, Gardner, Fitchburg, Southbridge, Worcester. Then you have a plan. It's Boston LTSS Community Partners, which has VinFin and Bay Cove, Justice Resource Institute, BCIL, Boston Center for Independent Living, has 2 elder programs, actually 3 elder partners. And if you look at Greater Boston, Boston-Primary, Revere, Somerville, Quincy, Northern, they cover Malden. Southern, they cover Brockton. Then if you go to Boston Medical Center, you've got Boston Allied Partners, Greater Boston, and Boston-Primary. So you get a sense that's through Boston Medical Center. I guess they must think they have the developmental disability expertise, or they have enough relationships they'll refer to. And then Elder Services in Merrimack Valley, again, very somewhat narrow, Northeast Independent Living Center and Elder Services. They have Haverhill, Lawrence, and Lowell that they cover, not a huge area. And then you've got Family Service Association, which takes on the southern region, Attleboro, Barnstable, Brockton, Fall River, Falmouth, so on and so forth in terms of the southern tier, and goes into parts of Cape Cod. I assume they would cover a good piece, if not all of Cape Cod, given Orleans, Oaks Bluffs, Taunton, Wareham, Plymouth, Nantucket, New Bedford, Falmouth. You know what I mean? So it's pretty wide-ranging. They have no partners. I assume they must have said they have contractual relationship with other organizations. Innovative Care Partners, their region is Western, Adams, Greenfield, Holyoke, etc., all the way to the border and all the way across to Springfield. And they have Center for Human Development and Gandara Mental Health Center and ServiceNet, Inc. And then you have Seven Hills Family Services as partnership with, looks like 3 agencies in our space, 4 agencies, Advocates, HMEA, BAMSI, and of course Seven Hills, as I mentioned, and then also Elder Services partner, Bay Path, and Boston Center for Independent Living. And they've got a northern region they're planning to cover, they've got a southern region they're planning to cover, and a central region they're planning to cover. So quite a big swath. The state, the central region goes as far as Framingham and Waltham. The northern region goes up to Haverhill, Gloucester, and Beverly. Their southern region touches the Cape, too. Yeah, so that's going to be interesting the way they structure the towns, but I assume that's to reflect, as in the other one, that it does cover a good piece of Cape Cod. And then Western Mass Elder Care. They've got Stavros Independent Living. They've got, looks like several elder services. And then they've got Stavros and AdLib, both independent living centers. Life Path Inc., I think that's an elder service center, behavioral health network, and so it's heavy on the elder side. That cover the central region, Athol, which is way north in central Mass, then the western Adams, Greenfield, Holyoke, Northampton, all the way up to the Pittsfield border. So just to give you an idea of that coverage area. And finally, Greater Lynn Senior Services. It's a North Region partnership with Bridgewell, Northeast Ark, and Greater Lynn Senior Services. And again, I'm pretty focused in the northern region, going up as far as Haverhill and Beverly, Gloucester, and then down to Woburn, and then it's close to Boston with Lynn and Malden. So literally almost touching Waltham with Malden there. So that gives you a sense of the scope and the region. There's a posting in the MassHealth brochure. You can learn more about it. Here's 2 links, thearcofmass.org/resources/services. And then up on MassHealth side, and again, we have this written, so you won't have to remember it, to really get to the learn more about services. It's mass.gov/EOHHS/consumer/insurance, MassHealth member library. And all I can suggest there is the other way to learn about, A, I would use that link because, number one, you'll get more detail, but B, there is mass.gov/MassHealth as another doorway, which is a simple one to remember. So that's really a sense of the program. It's pretty major change. A couple of takeaways again. If you've gotten a letter, please do not ignore it. If you're nervous and you think you should have gotten a letter, I think you should reach out. Again, this would be for people who are Medicaid only. Okay, remember that. You're a Medicaid consumer with disability and you're Medicaid only. Okay, no private insurance, no Medicare. And again, you can opt out. You can stay with that private network. Once you're in the program on March 1st, 2018, you have to stay in it for a year. And it's like a typical, you can go back to the PCC after that. Secondly, within each program, you have to pick the primary care practitioner, remember, but you can change in all these programs your primary care practitioner at any time. So you may be in the program once you've picked it, but you can change your PCP in any of these programs during the year. And I would talk to, what I would do is if you were at all interested or you've been identified for a program and your doctor or PCP is already in an ACO, I would really research that ACO and see if they have the right kind of, specialist for you. And if they do, and I would call your doctor's office and say, look, I have this neurologist now, but it looks like he's not in your network or she's not in your network. Who would you recommend? And you can do some homework now while it's December on that person, and you may decide, you know what, I want to go with this. I want my care to be integrated. I want my son's care, daughters to be integrated. And these are the things you got to think about, integration versus non-integration. If your physician's in a plan and you don't want to be in a plan, what does it mean to give up the physician? If your physician is in the plan and you're not worried about other specialists, then you're golden. I would think you give it a try for a year. But these are the kinds of things you want to think out. And again, we'll have another session. Terry Mahoney is going to coordinate next month. And for now, get the brochure, learn more about it. Part of life. Costs are going up. Number of people are going up. It's part of sort of the world we're in today. And I want to wish you good luck, good fortune. Have a great holiday season. And we look forward to talking more about this and other issues in the months ahead. Kerry, do you want to sign off?
Well, thank you, Leo. I appreciate all the good information you provided. And this will be up on the ARC of Massachusetts resource pages in a few days, so you can look for it then. Okay, well, thank you, and thanks for joining us. Take care.
Take care. Bye-bye.